Dr. Fletcher, to what extent have waiting times for mental health appointments been due to diminished staff? And I'll ask the same question of our other witnesses as well.
Thank you for that question. So what we've heard again from the warriors we serve is that they are experiencing access to care difficulties, and that can create problems. We know that warriors with the best outcomes have access to evidence-based treatment, are well informed about the medications that they are taking, and again, are active participants in the treatment planning process.
Dr. Koviak?
Yeah, we are aware of shortages in mental health providers and access to care within mental health and VA. That's not unique to the VA healthcare system. So the wait times we're seeing in VA are also reflected in the wait times that veterans are experiencing when being referred to the community. So it is a much bigger problem than just VA.
It's not unique, but what is maybe unique, certainly unusual to the VA healthcare system is that it is discouraging talented mental health professionals from coming to the VA through policies of furloughs and firings. Would you agree?
So I will say through our cyclical reviews where we go out to facilities not for cause to try to get a feel for culture and quality of care practices, we are getting more feedback that morale is going down because of the uncertainty within the federal government. So yes, while they aren't participating in the DRP or didn't participate in the DRP or other programs, clinical staff were exempted from that they are still losing clinical staff because of morale.
Morale going down means
Correct.
that fewer talented and skilled professionals are going to come to the VA or stay. They're going to be leaving if morale.
Yeah, I mean, I have to say these are discussions we have with leaders. We are not asking them to validate the data, or they're just sharing in a conversation the concerns at the local level.
Did you have anything?
I would just
Sandra?
quickly echo what Dr. Kroviak said about the nationwide shortages applying to both VA and inside as well as outside. I would just also, in terms of distinguishing between within VA care and outside care, for the VA, there is a timeliness standard for care in a VA facility. They don't have that for receiving care in the community, which means that VA is limited in its understanding of how long it's taking for a veteran to be seen in the community, or what the challenges are, how best to address them. And we do have an outstanding recommendation for VA to establish a timeliness standard, which would help give us more information about the differences. And of course, timeliness of care is an access to care issue, because the longer a veteran has to wait, that can exacerbate health issues. Thank you.
And of course, the Wall Street Journal article the chairman referred to a little while ago, Combat Cocktail, How America Over-Medicates Its Veterans, I think indicates that the care for them, mental health care or other kinds of care, is really important to prevent the over-medication that often results from the cocktail of pharmaceutical drugs that may be prescribed sometimes wrongly or inadvertently. And I wonder if you can say, Dr. Fletcher, whether there should be stronger safeguards, oversight to prevent that kind of problem.
Thank you for that. What we hear from our warriors is that they want to spend more time with their providers. They want to fully, process through their trauma, their symptoms. They want to be informed about the medications that they're being prescribed. We know that consistent follow-up increases chances of treatment adherence and treatment compliance. Consistent follow-up allows providers and veterans to identify medications that may not be working properly, avoid symptoms, side effects that become too uncomfortable. That consistent oversight is important to successful clinical outcomes.
Well, again, my time is about to expire. Let me just say that I appreciated both the OIG and the GAO findings, which I think are tremendously important. Just as one example, 33% of VHA facilities were not in full compliance with requirements to have a pain management team. That seems like a really basic failing. And again, you can't have pain management without the personnel to do it. And I think, unfortunately, the VA is sacrificing that tremendously important capability. Thank you, Mr. Chairman.
Senator Tuberville.
Thank you, Mr.